Let's go further in depth now as we are joined by Dr. Sanjay Jain. He is a board-certified physician. He is the author of the new book, Optimal Living 360, Smart Decision Making for a Balanced Life. Dr. Jain, as always, it is good to have you here on America's Forum.
Oh, thank you for having me, JD. It's great to be here.
Sanjay, a new report from the New York Times says that according to the Centers for Disease Control, Ebola cases could top 1.4 million in the next 4 months. How confident are you, Sanjay, that the global health community can regain control of such an outbreak?
I'm confident, but it's a little bit of measure of concern just because it's a wait and see, because that 1 million wasn't even in the conversation before. Before we were talking about 5,000, 20,000. Now we're talking about 1 million. That's a big jump. So it really is concerning. We're jumping from that number, 20,000 to 1 million. So until we really get the international community on board and really helping, Western Africa, it's still, I have to wait and see. It's a really wait and see approach for this.
Now, Doctor, a few specific instances to discuss. A Red Cross team was attacked while collecting bodies believed to be infected with Ebola in southeastern Guinea. This is the latest in a string of assaults that are hindering efforts to control West Africa's current outbreak. Is this a cause of panic, or is this something else?
When I heard about that, I thought it was barbaric. I mean, can you believe it? You got healthcare workers being attacked. Now, I'm not sure if it's terrorism or who these people are, but it's unbelievable. So it's really, it's a shame that it's happening. I'm really glad the military forces are actually coming in and providing security for these healthcare workers, because it's really unacceptable. So it's actually a measure where we had to get security for our healthcare workers and also make sure we have enough healthcare workers to provide the healthcare in Western Africa.
And a male nurse who was bitten by an Ebola patient has been flown to Switzerland for treatment. Can Ebola be spread with this type of contact?
Any bodily fluids are game. So, saliva, sweat, all that contact, it's absolutely game for spread of infection. So the worst thing that can happen if this goes airborne. So right now, if it's bodily contact, that's fine. But if this thing goes airborne, we're in a heap of trouble.
Sanjay, as we talk about the threat of this illness being spread in airborne fashion, we need to go to the bottom line, the overall costs, both in money and in resources. A USA Today report quotes doctors saying they are ready in case the outbreak reaches us here in the United States. Do you agree with that assessment?
I agree, but working in a hospital setting, I see where there's also cracks in the system. So places like Emory, some of these tertiary care, these university hospitals are probably well equipped. But when you're talking about a more prominent infection in more of the smaller community hospitals, that's going to be a problem. So I absolutely have confidence in some of the Cleveland Clinics, the Emorys, the hospitals in New York City, some of these bigger hospitals in handling this crisis. But if it goes beyond that, or it gets into the smaller communities and smaller community hospitals, that could be a concern.
So, Sanjay, what you're telling us is basically there are a couple of things that keep you awake at night if this were to cross our southern border or get into a rural area where there are not all the assets that major metropolitan care facilities could have. Is that basically it?
I agree, because I've worked in some rural hospitals in some remote areas early on in my training, and I've seen what the facilities are like. And they're obviously ahead of Africa, but there's still some issues in terms of how well equipped they are in terms of handling Ebola. So overall, I do have concerns, like you said, if it does cross the southern border, some of the hospitals out there, they're not well equipped like the bigger hospitals are.
So, Doctor, they're working on 2 different treatment vaccines. What are the stumbling blocks to this? Is this something that could help us with this outbreak? Is this what could save us from this?
About a minute left, Sanjay, for your answer.
So, there's the big thing that we've heard about is DMAP, and that's a serum that they take from the blood and using for treatment. The only problem is that it's the testing and it's the paperwork, the bureaucracy. So having to get through that bureaucracy, trying to get production, getting the type of raw materials to create some of that antibody serum, that's the challenge. So that's the biggest problem in terms of supply and demand. There's a big demand, there's very low supply.
Dr. Sanjay Jain, we thank you for making this Skype call into us as opposed to a home call, but you're just what the doctor ordered. Thanks again, Sanjay, for your input this morning. It's scary, the whole specter of Ebola coming to these shores. What about your concerns? Do you have them about Ebola? Why don't you tweet us your remarks at NewsMax TV, #America's Forum. There's also newsmaxtv.com/ comment, and don't forget Facebook. Our face is back on the other side of this break.